Positioning project number 4, PA stomach. Patient preparation. I met the patient and introduced myself. I gave her instructions on how to ingest the barium and how the barium contrast works to make the gastrointestinal tract visible radiographically. I then proceeded to ask her to tell me her name and date of birth so I could verify her information correctly on her chart and wristband. I then asked her when her last menstrual cycle was to make sure that we didn't have to do a pregnancy test before we started the series. Once the patient verification was complete, I had the patient lay on the table in the prone position. IR size. For this imaging series, I used a 14 by 17 inch, 35 by 43 centimeter cassette. IR orientation. I positioned the cassette into the table bucky in the portrait position. IR location. For this image, I am using the table and the table bucky. SID. I aligned the CR to the table bucky and set a distance of 40 inches, 100 centimeters, above the table using the digital display on the CR. Patient position. The patient is in the prone position on the table with arms up beside the head. Part position. I aligned the MSP to the CR and to the table to ensure the body was not rotated. CR location. The CR is perpendicular to the IR and centered about 2 inches, 5 centimeters above the level of the L1 and near the midline, and slightly left to the stomach. CR angulation. There is no angulation. Collimated field size. Collimation for this image is centered at the stomach, 1 inch past the left lateral abdominal wall. The right side is just past the spine, superior to the diaphragm, inferior about 1 inch above the pubic symphysis. Visual of appropriate marker location. For this image series, my marker is placed in the lower left corner of the cassette inside the bucky, so it is in the image, but not impeding on any anatomy of interest. KVP range for this patient. This image I used 110 to 125 KVP. Instructions to the patient for the exposure. I instructed the patient to take a deep breath, blow it out, take another deep breath, and hold it. I took the image and then told the patient to breathe and relax. Anatomy demonstrated. The entire stomach and duodenum are visible. Items in profile. Nothing is in profile. Pathology best demonstrated. Clinical indications. The PA stomach best demonstrates polyps, diverticula, bezoars, and signs of gastritis in the body and pylorus of the stomach.